Broadcast is now starting. All attendees are in listen-only mode.
Good morning, this is Jennifer Lasanti, the Director of Sales at Beere&Purves. I hope everyone is healthy and patient as our COVID journey continues on, unfortunately. Thank you very much for joining our webinar today. Beere&Purves is very excited to announce our newest carrier, Cigna plus Oscar, effective October 1st. A couple of housekeeping items before we get going. We will be sending out a copy of the recording of today's presentation. Everyone is currently on mute, but we would love questions, so just type them in and we'll address them along the way and definitely at the end. With the current economy situation, I'm sure your clients are kind of desperate for some answers and possibly new solutions. So we're very excited to be offering a new carrier, Cigna plus Oscar, to be able to present that to your clients, see if it's a good fit. At this point, I will go ahead and turn the presentation over to Michael Lujan. So I think everyone probably knows him very well, and he doesn't need a big intro. So I want to thank him for his time and his team's time, both Thomas and Kaylan, and we'll just get to the meat of it. So Michael, go ahead and turn it over to you.
Thank you, Jennifer, and thank you for hosting a spotlight for us to introduce this new product. As Jennifer said, Cigna plus Oscar is a new small group offering for the Bay Area that's being made available for this Q4. I really just wanted to open this up to a few comments and just one, say how excited I am to be working with brokers again in the Bay Area. Many of you I've known for decades, and we've had the pleasure of working together before. But as Jennifer said, we're in unusual times. These are definitely different times that require different solutions, and that's what we're talking about today. So I look forward to the day where we can actually do this in person, actually break bread together and see each other face to face. Until then, we do this virtually. So first time I've ever did a product launch virtually, 100% virtual. So it's definitely different. So on behalf of our team, you can show the next slide. That it'll show the entire team. That's me on the far right, Michael Lujan, Director of Sales for the West region. Thomas Earl will kick off our presentation, and Kaylan Kelsen, you may have met both of them at some point. Actually, Thomas, let's start with a quick background and let them know where you came from before you joined Oscar.
Sounds great. Thanks, Michael. So Michael had stated, my name is Thomas Earl. I'm the sales executive here with Oscar, in charge of the Cigna plus Oscar product for San Francisco County and East Bay, so Alameda County and Contra Costa County. So if you're located within one of these three counties, then I will be your direct point of contact for all things Cigna plus Oscar, alongside with the Beere&Purves team. Formerly, I was with Cigna, selling large and small group with their medical team all over the Bay Area and outside of the traditional Bay Area. Before that, I actually was one of those weirdos who decided to enter the insurance industry at an early age and studied insurance in college, which is where Cigna recruited me from. So been around insurance a lot of my life, excited, and really happy to be part of the Oscar team selling this Cigna plus Oscar alongside with Cigna. So with that, I'll turn it over to Kaylan.
Hello, everyone. This is Kaylan Kelsen. I am your senior sales executive covering the San Mateo and Santa Clara counties. Looking at this attendee list, it's really lovely to see some old friends from when I worked in the small group space before. So very excited to be here with Cigna plus Oscar. Previously, I was working in health technology, staying true to wanting to work with startups in the insurance industry. So really just, it's a pleasure to be here with all of you, and thank you for the warm welcome and introduction for Cigna plus Oscar.
Very cool, and I'm really proud of this team. Thomas jokes that he is born for insurance, but I call him a Pegasus unicorn. Very rarely, most of us get into this business accidentally. That's certainly the case for me. Thomas was born in insurance, went to school for insurance. He's made for this. And Kaylan, with her brilliant background, like me, I think we're both stubborn disruptors. We see a lot of opportunity to change what's happening in the healthcare and health insurance industry, and we're going to keep on doing it until we get it right. So I think this is a great opportunity for us to introduce this product for the Bay Area. So the Bay Area is different, always has been, and will continue to be. You go next slide. I think that's what this introducing this product really means, that small businesses actually deserve more. They deserve better. And I think I'll get a little bit preachy here, but I think what small businesses have had to do over the recent years is downgrade benefits, narrower networks, going from platinum to gold, gold to silver, silver to bronze, in order to mitigate rate increases. And so one thing we think about a lot is, what are companies going to have to do this Q4 or January to help mitigate rate increases or to get their budget right? I think we're all fortunate that there hasn't been massive layoffs as expected because of the economy and what's happening related to COVID. So, knock on wood, that's good. But most of those companies are saying, I'm still looking to reduce my expenses by 10 to 15%. So to the brokers who are going to address this issue, how are you going to do that? How are you going to find 10 to 15% savings without doing massive reductions in benefits and buy downs? So I think we have an answer for that for Q4, and that's what we're talking about today. So next slide, if you would, just transition that over to Thomas, who's going to give you the first round of why we think the Cigna plus Oscar partnership makes sense and is a good answer for this. Go ahead, take it away, Thomas.
Great, thanks, Michael. Well, first I want to talk about the two companies that are bringing this partnership to the market. So first is Cigna. Most of you probably are aware of Cigna. You may have even sold Cigna in the past. Cigna is a very large insurance carrier, been around for a long time, over 225 years. They are ranked 13 on the Fortune 500, so very strong financials. They do have 17 million global customers, so they are one of the largest global carriers and typically one of the top 2 or 3 medical carriers here domestically. That also is helpful attributed because of their very large medical network across the United States, as well as their pharmacy network, which grew even bigger after their acquisition of Express Scripts as their PBM. So very large and strong positive carrier. But really in the past, Cigna has not gotten too much into the small group realm. And then that's not just here localized in Northern California, that's all the way across the United States. They've been a very big main player in the large group and enterprise world. This Cigna really hasn't just been able to crack into the small group realm that often. And this has always been something that they've been wanting to get into. So keep that in mind as we go forward. The next carrier is Oscar. Oscar was founded in 2012. We are in 3 product lines in 26 markets across 15 states. So we are an enterprise national carrier with over 425,000 members. Now this membership growth is exponential. This has been great membership growth. Just in the last few years, we've been able to double our membership on a consistent basis, now earning over $2.2 billion in revenue. And right now we have $1.5 billion in current raised funding to companies such as Alphabet, which is Google's parent company, Fidelity Investments, Charles Schwab, and many other investment firms. As we go through today's lesson, I want to talk about the better values for employees. Then Kaylan's going to walk you through the affordable plans and the network choice offerings with Cigna plus Oscar, and then how we're committed to making it easy for you, both from a selling standpoint as well as being able to manage your book of business with Cigna plus Oscar. So as I reviewed the two carriers, keep in mind these are two separate insurance carriers, but we're coming together to create a joint product that works for the small group. So what is Cigna bringing to the partnership? Well, first, Cigna is bringing the network. As I talked about before, Cigna has a very strong and accessible network across the United States and on a localized performance level. So Cigna is bringing the network first. Next, Cigna is also bringing their legacy. They're bringing that underwriting capability that they have. So this is all these contracts are written on Cigna licensed paper. And then third and finally, Cigna is bringing their financials. So that strong, positive, long-lasting financials that Cigna has of being a top 20 Fortune 500 company, Cigna is bringing their AM Best score and their financials. So put quite simply, they're bringing their financials, they're bringing the underwriting and their license, and they're bringing the network. Everything else is coming through Oscar. So it's Oscar's digital and human experience that Oscar is bringing to the partnership. So think of the sales team, think of claims adjudication, think of customer service. All this digital and human experience is coming through Oscar. And Cigna is bringing that network, the financials, and that legacy contract license paper. Everything else is Oscar. I do want to point out here that this is not Cigna paying a PEPM for Oscar's administration and technology, and this is not Oscar paying a PEPM for Cigna's network. These are two carriers coming together, bringing both mutually benefiting off of this partnership with a 50-50 risk share between the two carriers. So this truly is a joint partnership product. So small business is different here. You heard Michael say that. In Northern California, small business is very different. We have organizations that you really need to grow and flourish here that can ultimately be these large businesses. Think of Salesforce.com, Twitter, Uber. Many of these examples continue to go on the list that were founded here in the Bay Area in San Francisco and are now multi-billion-dollar companies. But at one time they needed to grow and they needed to retain this talent. And this is really, truly, it speaks to why small business is different here. And they even is more different now as we enter the world that we're in now. These small businesses expect more and they deserve more. These are some of the pain points that we hear on a daily basis. And we know that you hear them moreover than we do. The typical responses are, my networks are narrow. I'm now being forced to move to that narrower network. I'm having to move my metallic tiers, as Michael had stated. You're moving from a silver, and now you're moving down to a bronze. All the while you're still accepting a renewal increase, but you're still increasing the out-of-pockets and the deductibles and your co-insurance. Quite frankly, health insurance is just confusing and inconvenient for both the member and the client to utilize. They're paying for this expensive product and not receiving the care and the service that they should. And telehealth is no longer just nice to have. In this virtual world that we're living in, this needs to be part of every benefits package and accessible to each and every member. So I'm really excited that with Cigna plus Oscar, we're addressing each and every one of these pain points. That's what we set out to do alongside Cigna when we developed this product. So first off, I talked about the network from Cigna. We're offering two robust networks to the Open Access Plus and the Local Plus network, which Kaylan will get into. We're offering free and unlimited telehealth medicine through our virtual urgent care, a dedicated concierge team for every Cigna plus Oscar member that offers a true white glove experience, a business concierge for your clients as well, continuing to offer that customer care for those clients as well. And then ultimately still being able to bundle this together and offer premium savings to the members through those benchmarks, HMOs, and PPOs that we have here in the Bay Area. So I want to talk about the value for the employees that Cigna plus Oscar offers. So first we'll start with the concierge team. So each and every Cigna plus Oscar member receives 4 care guides. These are dedicated care guides to that Cigna plus Oscar member. So they know the Cigna plus Oscar benefits and they know the Northern California network nuances. Now, these 4 care guides make up most of their care team. So each and every time that member has a question, whether it's understanding their benefits, finding local in-network physicians and scheduling an appointment with them, helping them prepare pre-op or post-op, and ultimately just getting to utilize the benefits plan the way it should be utilized, they're there for them. On top of these 4 dedicated care members, they also have a dedicated care nurse. So that care nurse is there for any escalation questions that might need to go past someone with a little bit more of a medical experience trained eye. So these 5 individuals are there for that Cigna plus Oscar member. Their faces, their photos, their names, they're there dedicated for them. So should that member have a question, they know who they're going to reach out to, they're comfortable with who they're reaching out to, and they're continuing this conversation rather than calling that 1-800 that might have been rebranded as something else and having to re-explain their medical health record while they're also on the other end of that line, counting down the seconds to then they have to get that member off the phone. So this is a true white glove concierge experience that every Cigna plus Oscar member receives. This is where that care team lives. So they're there within their application as well as their online portal on their laptop or home computer. They can access that care team, whether they want to do it through a click to chat or whether they want to pick up the phone and give their care guide a call. There, they'll also be able to access our coaching programs such as autism, eating disorders, substance abuse. They can access our parent and family programs. They also can be able to reach our 24/7 hotline. And a great aspect about this is they can access our Cigna behavioral health specialists through their care team, as well as a virtual application through our partnership with Talkspace. So here they'll be able to do so many things to their application and outside of just being able to speak with their care team.
Hi, Thomas. This is Jennifer. One quick
Yep.
question along the way. I'll stop you. The question was the concierge team. Those are Oscar employees, correct? Those are not Cigna employees.
Correct. These are all Oscar employees. So remember, in the partnership, Oscar's bringing that digital and human experience to the partnership.
Perfect. Thank you.
Mm-hmm. Next is our 24/7, always free, always unlimited virtual urgent care. So each and every Cigna Plus Oscar member, whether you're on the leanest bronze plan or the most robust platinum plan, always has free and unlimited 24/7 access to virtual urgent care. So right there in their application, they can go onto their phone and they can click to chat with a physician, or they can give that physician a call. They can add photos to their conversation. This is really great because these are Oscar employed physicians as well. So with them being Oscar employed board certified physicians, we're able to offer a cleaner experience for our member. So you're not going through a carrier application and being directed to another application to download this. What also is great about this is that since these are Oscar employed board certified physicians, there's less of a information transfer kind of cut through for a firewall, you would say. This is all a holistic viewpoint for our physicians. So as you're seeing your physicians, they have a more holistic viewpoint into our members because this information is not being traveled and shared through an outside vendor. So it's great. And what's another great ability is that by removing that urgent care copay, whether it's an in-person visit or a virtual visit, for each and every one of our members, the only experience that the cost share experience that they feel is when they go to that prescription and they write that prescription cost. So really being able to remove the out-of-pocket costs for our members, always free and always unlimited for each and every member on Cigna Plus Oscar. So a really great resource for all of our members. Even before we've going through the world that we're in now, we saw over 7 times utilization with our virtual urgent care versus the industry average. And that's really no shocker to us when it's free and unlimited and always available for every member with Cigna Plus Oscar. Next, I want to round out more of our network here, starting with Express Scripts. This is our PBM, and we also are utilizing Accredo for our specialty. I do want to point out that we are utilizing the high performance formulary, which is a very large, robust formulary that's typically found on Cigna's large group clients. So really great to bring this large, robust formulary for our small group clients. We're also utilizing Quest and LabCorp for our national labs, and Liberty and Davis for pediatric care, and then CBH, Cigna Behavioral Health Network, for our behavioral health network. All of these points of contact will be channeled through your care guides. So when a member has a question and let's say wants to schedule an appointment on their behavioral health network, they'll be able to contact that dedicated care team for them, and they then can be able to schedule that behavioral health appointment for them. Now, of course, the member can also go outside and schedule this appointment on their own, but it's great to be able to have our systems communicating and talking together so that that member has one point of contact that they're familiar with, and that they're okay to have that communication with, rather than having to reach out to Express Scripts or CBH on their own. And it's great to have that single point of contact, which is reiterated in that Oscar part of the partnership, that digital and human experience for each and every member. So next, I'm going to turn it over to Kaylan, who's going to talk about the affordable plans and the network choices that we're offering with Cigna Plus Oscar.
Thank you, Thomas. So we are offering an EPO with the Cigna Plus Oscar. So it's going to be some great selling points here. We're able to reduce the cost when we offer no out-of-network benefits, and in partnership with Cigna and the great networks that we have, there's really no need to be going out of network. So we wanted to pass those savings along and be able to offer the EPO network and transfer those cost savings to our members. And then when you're looking at comparing an EPO with an HMO, what's great about the EPO is you don't have to go to your gatekeeper. You can go directly to your specialist. It saves time, it saves money, and there's no referral needed. Here I am. And so when we take a look at the network options that Thomas was mentioning, we have the Local Plus, which is going to carve out Sutter. and then the Open Access Plus as well. So there's nothing narrow about these networks. If a member is not going to Palo Alto Medical Foundation or Sutter facilities and they want to save about 15%, then the Local Plus will be the better option for them. So we have all the major providers that those large groups are, leveraging with the Cigna networks, and we have that opportunity now to deliver that to the small groups. And in junction with that, we are going to be offering 16 plans. So it's going to be 4 bronze, 4 silver, 4 gold, and 4 platinum plans. And it's going to include 2 HSA plans in the bronze level. And every single plan includes free and unlimited telemedicine with those Oscar doctors that Thomas had shared with you, and they're available 24/7. So that's a huge cost savings. It's in the convenience of your home, so you don't have to worry about going to the doctor's office right now during a pandemic. So the ease of access, it's free and unlimited, and it's included in all of our plans. And you have the option to mix and match these plans. So it's any 3 plans here. So if you want to take the bronze, Local Plus network, a silver, Open Access Plus network, and then a platinum Open Access Plus network, that's totally fine. So there's no adjacent metal tiers that you need to do here. You can do any 3 metal tier plans alongside mixing and matching those networks to make that flexible for the members. And when you're doing your rates and benefits side by side, really keep in mind the Oscar digital and human support that they are getting with the Oscar program. So it's not just the plan enhancements or the rate decrements, it's also the rest of that human digital experience. So it's going to be the access to messaging your dedicated care team, those 0 doctor on call, the ease of access of prescription management, and then earning step tracking. Just by syncing your device with the Oscar application, you earn $100 just for walking around. And so overall, this is about $600 per member per month in per member per year in savings, on top of the savings that you'll see from the plan enhancements and the network access and those rate decrements that you might see against their current plan offering. So what does that mean for you? Cigna Plus Oscar is going to offer better networks, really phenomenal plan designs, and you're going to have something new to talk about. So most groups are shopping this year. The McKinsey study that we did recently says that groups are 4 times more likely to shop their plan this year. So it's, they're looking for those savings, they're looking for those enhancements to keep them competitive against, some of those bigger organizations that are out there in the Silicon Valley. So, really keep this as top of mind. And how we're going to make it easy for you, we're going to make it easy for members. We're also going to make it easy for you as our brokers. And that means easy rules and tools. So we have the great state of California, 39 million people here. And lucky us, Cigna Plus Oscar is going to start in the Bay Area. And so what we have here is each company needs to be headquartered in either San Francisco, Alameda, Contra Costa, San Mateo, or Santa Clara counties. And the employees must live within one of these 5 counties as well. If they live outside, out of county, out of state, no more than 30% can live outside of these rating regions, and that's a participation requirement for us with Cigna Plus Oscar. And if they are living outside of these 5 rating regions, they do need to elect the Open Access Plus network. And we wanted to make these underwriting guidelines standard and easy, so there's no confusing promotions. These are here to stay. And so we talked about the participation, that they must live in those 5 counties. Also, we're not going to require any DE9C for more than 6 enrolled. There's valid waivers or just your usuals, Medicare, Medi-Cal. In addition is going to be the IFP waiver, so the individual waiver as well. And this is awesome. So I hope you all are really listening here. When you're offering Cigna plus Oscar alongside another carrier, we're extremely flexible. It's any carrier. So whether it's the usual Kaiser or Anthem or UHC, we will pair alongside any carrier. And there are no limits on the plan types and metal tiers. Again, it's any 3 plans. And when we talk about the participation that we need, hope you're listening here. You have, as long as after all the valid waivers, 60% of the population must enroll with 1 carrier. And then Cigna plus Oscar just needs a minimum of 3. So extremely competitive when we're sitting alongside another carrier. We really want to make those options easy and accessible for members who perhaps are on a different carrier to sit with Cigna plus Oscar for more options.
Hi, Kaylan. We have one question that fits in right here,
Yep.
And that is, does Oscar have does Cigna plus Oscar have an issue with offering a gap policy alongside you guys?
Gap policy like an HRA policy?
I believe that is the intent of the question. Yes.
Okay, yep, thank you for calling that out. Yes, we do allow HRA, so no statement of understanding. This is actually a great way to fund out-of-network benefits that, we all have those executives that want that one doctor that's not a network. It's a great way to help fund that. And then we don't have any restrictions on the amount of funding under the plan. So that's a great solution to help saving, more savings for these small group employers for sure.
Okay, thank you.
Yeah, Kaylan, just chime in just to specifically on gap plans. Absolutely, those are fine. Gap plan, hospital indemnity, critical illness. There's a whole suite of supplemental plans that fall outside of HRA. Those are good too.
Okay, thank you, Michael.
Perfect. So bookmark this page. It's hioscar.com/brokers/Cigna. This is where you can get appointed with us. This is where your collateral that we have released is available. It's also where plan grids, rate tables will populate as the regulatory becomes approved. This is also where you want to search your in-network doctors and your prescription drug formularies. There's a small nuances between Cigna and Cigna plus Oscar, so please make sure when you are verifying providers that you come to our website in order to be extremely accurate there. And this is also where we'll be, again, providing more rate tables and plan benefit summaries when made available. So I mentioned that website is also where you can get appointed. It's easy, 3 steps. If you are already appointed with Cigna and you're already appointed with Oscar, you just need to link them together. If you are not appointed with one or both of those carriers, the steps are also in here for you to get appointed with those carriers. Keep in mind that it does take about 10 business days to complete this appointment process. So you can go through, it'll say you're done, and then you'll get an email saying that you are approved. And we are making quoting as well as seamless, easy enrollment. Of course, please look to your Beere&Purves team. Thomas and I are here to support you as well. We are compatible with ease. The approval time that we are averaging is 24 hours approval time, which is really great that we are able to then deliver digital ID cards through the application immediately for the members upon approval. So there's no waiting around to pick up prescription drugs or see their provider. If they have those needs, the digital ID cards are right there and available for them. And then broker support. Of course, we want the first points of contact to be myself, Thomas, your Beere&Purves team, but if you do need additional support, we are here for you. Our team does sit in Tempe, Arizona, so currently on our time zone, 5 a.m. to 5 p.m. Pacific Standard Time, and here's the ways to contact them. And they're a great team. So some quoting tips, your Health Connect or other platforms that you may be working on, make sure to look for Cigna plus Oscar, not Oscar. That would be Oscar in Southern California. So when you are quoting, it will show Cigna plus Oscar. Remember to select EPO plans because we're not a PPO, we're not an HMO. We're a better product. We're the EPO plan design. And both networks are full, so there's nothing narrow. there's nothing limited about them, but just make sure that, if a member does really want Palo Alto Medical Foundation, that they are electing the Open Access Plus plan. And that's also important for members who live outside of the rating regions. They need to also elect the Open Access Plus. So it's important to get the employees' home zip codes in order to make sure that you have the right participation for the service areas. And then check out our bronze high deductible health plans. I know that PPOs have been really, or HSAs have been very popular in the Bay Area and well adopted. We have some really great strategies. We're going to be really competitive there. There's also, I mentioned earlier with HRAs, we're going to be very competitive there. There's a lot of options there as well. And also just keep in mind when you're taking a look at this, I know we don't have the rates available to you today, but we've seen the rates, we've seen the information, and we're going to be most competitive in the Santa Clara, and then secondary will be the San Francisco County, and across the board, very competitive around the HSAs. So we are truly invested in your success. We are not going to tear down your renewal commissions. So it's going to be new and renewing business at 5%. And then we're also offering your vacation bonus program, as I'm calling it. So your first group of 4 or more employees will be a $500 bonus, and that's eligible through 1/1 effective dates. And then additional 4 groups of at least 4 or more employees will earn you $4,000. And again, that's available through 1/1 effective date. So the vacation bonus is $4,500 that you can earn with Cigna plus Oscar. So just to recap here, you learned about the care teams and the digital experience and that human support that we're providing, in addition to that $0 telemedicine on all plans, the affordable plans and networks that are going to be made available to our members through the Cigna network options. And then we really are dedicated to your success and your growth, and we have got some great broker tools and compensation out there for you. And Q4 is going to feel different this year. Certainly this has been a different year for all of us in 2020, and it's really impacting those small businesses. So you should really be thinking about different solutions and different options. As I mentioned earlier, the McKinsey study is saying that groups are 4 times more likely to shop their benefits this year. We're really excited to hopefully make that shopping list, and we are committed to earning your trust in your business. So thank you so much for your time today. It's been a pleasure. Here's myself and Thomas's contact information, and again, that website to access the collateral and get appointed. So do that today. It takes 3 minutes. Very, very quick. We'll stop for questions.
All right, so I think there's one question, sorry, I'll throw out there. I think there's a lot of confusion because there's Oscar down south, and then there's of course Cigna, which is a national carrier, and who does what. So commissions are paid by Cigna plus Oscar, correct? Not from Cigna?
By Oscar. Oscar has a parent company called Mulberry Management. So for brokers who've already been selling us, it'll be the same commission process you receive from Oscar. So to the point that was made earlier, it's really using Cigna's license and their 2 networks. Everything else is Oscar.
Thank you.
We pay claims, pay commissions, appoint brokers, support brokers, and I'll emphasize a point. I think Thomas may have made it earlier. There's a really solid level funding product that Cigna offers that I think goes down to 25 employees. That continues, and so if brokers are already having clients with that program or interested in level funding for their groups 25 or more, keep working with Cigna on that. Nothing changes there. It's a point we try to emphasize because we're adding an option to the market. We're not taking anything away by this joint venture. So keep doing what you're doing if you want to sell level funding with Cigna. But this is fully insured, small group, and by Oscar.
Okay, so excuse me, that just answered another question. So it is 1 to 100 small group only, correct?
Right. Guarantee issue. California is 1 to 100. Yep.
Okay. And I think everyone's excited and they're familiar with Oscar. And I think there's kind of bigger questions for bigger plans for down the road. But at this point in time, is the Cigna plus Oscar availability just through Cigna plus Oscar, or can you also get this through maybe CCSB and or CalChoice?
Yeah, too early to say for sure. I can tell you this much, that we've been talking to both of them, and we plan to be with one, if not both of them, next year. So we'll share more about that for 2021, but for Q4, it won't be with either of them for Q4.
Okay, thank you. And then I think the last question so far, there might be more that keeps coming in, so feel free to type them in if you have them. The Cigna in-network providers are the national in-network providers for the open access plan, correct? So they're just basically asking, the open access that they know through Cigna is going to be the same one available through Cigna plus Oscar.
That's correct, and I think the point that Thomas made, small businesses in the Bay Area compete with large companies, so this is the same network those large companies have access to. That's a point that I think we are going to keep beating as we go through the Q4 launch. Is even a full network and small group may not be as comprehensive as this network. So if you're looking for clients that are needing to compete, let's say you're hiring an engineer and they could go work for Salesforce or Uber or some other big company, you can offer a network through Cigna that compares with any one of those large group networks. Same network they offer to large groups.
Okay, thank you. And then of course the number one question, I'm surprised I didn't see it before. When will the rates be available, Michael?
We're all chewing our fingernails on this one here. I wished we could have those released now, and you guys have been very patient. These are filed with Department of Insurance, and I think you can respect we're being cautious to make sure that we have their approval. So we don't have it yet. As soon as we have that approval, it hopefully will be a matter of weeks. But we really were aiming this for 12/1 effective date. So we filed for Q4. But really the intention all along was to target for 12/1 effective date. So please keep us in mind, and I think Kaylan even said it as well. I'll give you a teaser. The rate savings is significant. So if you're thinking about rushing through and doing early renewals, you may want to pause and give some thought to clients that really need to save money. We're going to be able to offer a significant double-digit increase with a similar, if not better, network. So if you can hold off on some of those key clients, please do, because I think the savings will be worth it. And I'll give you one more hint. Santa Clara especially is very competitive. So rates in Santa Clara, San Francisco, very competitive. And across all 5 counties, we're really competitive at bronze. So for brokers thinking about an HRA strategy, take a look at that. We're talking about the best rates in bronze for high deductible health plans against all other competitors. So really just trying to give you a little bit of a head nod in a direction that gives you some idea where we'll be, but the rates we're not able to release just yet.
No worries. I think we're just all very excited.
What a teaser, right?
Exactly. Then there's a question, since these are EPO plans, if I'm a California employee on Cigna plus Oscar EPO on the larger, open access Cigna plan, when I travel outside of California, I'm assuming I have to be, unless it's an emergency, in an area using the open access national network for coverage while I'm traveling.
Yeah, and I feel like I'm taking all the questions. Thomas, do you want to grab that one? The network.
Yeah, so
best?
Absolutely. So if I'm correct to understand, the question is, if you elect the Open Access Plus and you go out of state, which network are you utilizing? Am I correct with that, Jennifer?
Well, it's just really kind of what benefits do I have? I'm assuming you have the same benefits
Correct.
that you would have if you were in California, but you would need to be in network at a open access Cigna provider out of state to have it covered,
Yeah.
unless
So
it's an
yeah,
emergency.
absolutely. So yes, for all emergency situations, of course, those are covered. But yeah, our open access plan is a national network, very, very strong, robust, accessible national network across the United States. So you have very easy access to care, no matter which state you'll be in, at the same benefits that you'll have enrolled on in California.
Okay. And then since Michael did tease that the HSA rates are probably going to be the most competitive out there once we see them, is there an HSA vendor that you're partnering with?
We're wide open. I think at this point, HSAs have been around and HRAs have been around for a while. We are putting together a follow-up webinar, and we may have a vendor that will co-host us with. So I'll just, we have with Health Equity, we've had a sort of a soft partnership with them for HSA. But we've been working with the Difference Card, a company, many of you probably already know and have worked with. Really slick, very sophisticated HRA vendor, just very cool. We'd like to promote the concept of HRA and HSA and let brokers or the GA recommend their preferred vendor. But we may be following up webinars with that particular vendor, the Difference Card.
Okay, just another clarification. Going back to the, if Kaylan wants to take this, about the 70% of the enrolling employees need to live in one of the Bay Area counties. 30% can be anywhere else, right? Outside of California, outside of those 5 Bay Area counties. Do you want to speak more to that? Kind of clarify
Yeah,
it?
so they can live outside of the 5 counties, so anywhere in counties outside of those 5, and then any one of the states as well. So the only thing that if they do live outside of those 5 rating regions, they need to elect the Open Access Plus network. So when you're quoting, make sure to elect that for those who live outside of those 5 rating regions.
Okay, thank you. And let's see. And since this is a small group product, 1 to 100, I'm confirming these are community rates, not composite, correct?
Yeah, California still does not permit composite rates. I hear, many employers and brokers have suggested just use an averaging for, deduction purposes, but technically speaking, California does not permit composite rates for small group.
Okay, thank you. And I think that is the last question that we have. I think we've actually got through them all. I do want to call out Thomas. You are the 3rd person in the insurance industry that I know that actually has an insurance degree. So I just want to acknowledge that. So I've been around for a while, and you're number 3. So we actually, Pat Hennessy at Beere&Purves is one of the other 3 people that I know, or 3 people that I know. So I just want to give you, I don't know what that says about you, Thomas, but that's okay. We all have kind of a joke in the industry that you kind of, no one wants to be in insurance, you just kind of end up here, and it's a good place to be, and we get stuck. But maybe you were just smarter than the rest of us and knew it was a good place to be before you got stuck.
There you go.
I appreciate that. Thank you for the call. I didn't know that. That's funny.
Another Pegasus unicorn.
Is there anything else that Michael, Thomas, Kaylan want to add before we close out today?
Real quick, I'll just make a quick statement. One, gratitude to Beere&P. You guys are a terrific partner. I think, the respect you have in the broker market is, just second to none. You guys do a great job of packaging, presenting, teaching, training, co-marketing. So I look forward to doing more events with you all to get brokers ready for this. So this was a sort of a 101 webinar to get folks familiar with what we're doing. If you have any follow-up at all, either through your Beere&P team or with Kaylan and Thomas, we are happy to help and answer questions. I'll emphasize another point. Not every carrier is GA friendly, and we aim to be the most GA friendly carrier out there. And by that, that means whenever you're working with us, you'll always get a bonus, a broker bonus, whether it goes through a GA or not through a GA. You'll never have Kaylan or Thomas competing, with the Beere&P reps about who's got run a show and who meets or doesn't meet, and whether or not we offer enrollment support. To me, it's just silly when I see some carriers do stuff like that. So we are very thoughtful about how we partner with you guys, and grateful to have your support as a GA, and look forward to doing tons of business with you all. And then maybe last, many brokers are also themselves small businesses, so I'm going to actually reach out and ask for your business. We would be honored to have your business, and let that be a strong testimonial of, where do you place your coverage. Take a look at us yourselves. I think you're going through some of the same economic issues that a lot of small businesses are. So if Cigna plus Oscar works for your agency, we'd love to have your business. So with that, I'll just say thanks for giving us a platform. And Thomas, anything else you want to add before we sign off?
No, just a big thanks to the Beere&P team. Really excited to be working together as we bring a great new option for Q4 and beyond. So really excited.
And this
Thank
is
you, guys.
Kaylan. I just have one thing to add really quick is, we know that this is new to everyone here. So if you want to bring, any one of us, the BP team, Thomas, myself, as your subject matter experts to, share the differences and the nuances, we're definitely here to support you as you get into fourth quarter selling season.
Thank you, guys. And I think, as everyone can see, there's just a lot of excitement. I don't know, it's been a while since we've had a new carrier, and I think this is in particular a good fit for the Bay Area market, with where we have a lot of high tech biotech firms that want a lot of hand holding. That clearly there's a big niche there for Cigna plus Oscar, along with all clients, clearly, with something new solution, competitiveness, et cetera. So we're definitely excited, and we will keep everyone posted once those rates are available. And just want to thank again the Cigna plus Oscar team, Michael, Thomas, and Kaylan, for your team today, and everyone else's time today, rather. We know everyone's busy. There's a lot of demands in our new COVID world, personally and professionally, and now as we're heading into Q4, it only gets worse. But we appreciate everyone's partnership, and thank you for your time today. And as the Cigna plus Oscar team said, we know you're going to have lots of questions. Reach out anytime, and it is something new and something to learn. So we're always here for you, along with all of our other carriers. Let us make your Q4 a little easier. Thanks again for your time today, and please stay healthy and stay calm. And we will send a recording of this presentation out today. So bye, everybody.
Thank you. Bye-bye.